Good afternoon, this is Dr. Do again. This video is on the still on the alphabetical list of problems. We start with A and then we talk about the B. Last time I have two videos talk about the blood. Today I kind of junction blood and coagulation, so I probably just move from bleeding disorder directly to the coagulation problem. So they both I meant to talk about the bleeding problem, and then in order to talk about the bleeding problem, it also has to involve in the coagulation. So I just moved from B to C, coagulation problem. Okay, so before we talk about the coagulation problem or bleeding problem, I'll just briefly introduce about the coagulation cascade. Why it's called a cascade? First of all, it's a positive feedback control. As long as it starts, cannot be stopped. Just keep going, keep going, keep going until the bleeding stopped. So this is a normal positive feedback in our body. Majority of body regulation, homeostasis through the negative feedback, but this is the one of the two positive feedback. The other one is the oxytocin regulation during the childbirth. I'm not going to talk about it now, but just let you just briefly talk about the cascade mechanism. So, for example, what kind of coagulation or bleeding problem need to see the emergency? Of course, from we have talked along bleeding, either internal bleeding or outside bleeding from trauma or injury and cannot stop. Of course, this is emergency situation. The other class of disease that need to go to the emergency relates to the coagulation problem, hypercoagulated. Some of them hypercoagulated may be subtle, maybe you do not know. Small thrombi, it's circulating the blood, not lodging anywhere, or just subtle lodge along the blood vessel, and we do not know, or you do not know, because the blood still flow, but just the slow through the narrow passage. But some of them, if the thrombosis fell off, becomes emboli lodged somewhere into the brain, cause a stroke. Of course, that's the case, you need to see the emergency. Or to the lung, pulmonary embolism. Of course, if that's the case, usually depends where is the thrombi lodged at, where is the emboli located. Associated with shortness of breath, may or may not have chest pain, hypoxia, and sometimes the PE, the pulmonary embolism, might be subtle. But anyway, if you had a history of coagulation problem, you feel shortness of breath, you feel heart rate really fast, that indicating probably you have the PE, which is pulmonary embolism. If that's the case, go to the emergency or call your physician. So these are the of course, the heart is another emergency situation. If you have the thrombi lodged somewhere in the heart, then of course that's the emergency, which is cardiac malinfarction. So go to the emergency room. So these are the major coagulation problem. We talk about the either hypercoagulated, have the thrombosis, or hypocoagulated, have the bleeding disorder. That's the case, you need to go to the emergency room. And then before I talk about the coagulation, let's briefly talk about the coagulation mechanism, the cascade. There, from factor number 2 to factor number 13 is either endogenic or exogenic. But these are the medical terms, either start from the epithelial tissue or start from the tissue itself, or start from the blood vessel wall. But it doesn't matter. So the coagulation factor is from the majority of the coagulation factor synthesized from the liver circulating the blood. So if a liver has a problem, so that increase the risk of bleeding, I talked last time. So basically, for example, the blood vessel has an injury, how the coagulation works. start, if there's an injury, the body receives the signal, so all the cells migrate to that site, localized, local injury area. The fibroblastic cells lay out the fibers, and also the blood has the protein called fibrinogen circulating the blood. So, and the platelet, of course, it's going there to form the thrombus, and the fibers kind of lining the fibrin lining up until finish the course is the individual fibers connected together. Coagulants becomes like a gauze, individual fibers, and then becomes a huge patch there, so to seal the injury blood vessel wall. So then the bleeding stopped. After the bleeding stopped in the normal process, and the endothelial cells start to recover, to regenerate, and this clot will be will be degraded into small pieces, like the gauze. It's finished up, so cut it into pieces, throw back to the blood circulating again. So this is the fundamental mechanism how the bleeding stopped. So these coagulation factors circulating the body, ready to start a cascade if there is injury, to form the blood clot, which is to stop bleeding. In some situation, if it is overactivated, overreacted, so then have the increase the risk of thrombosis. That is dangerous. The risk factor for this is genetic cause. Some of the genetic disease caused, for example, protein S deficiency. Protein S is the factor for coagulation factor. Protein S is a protein that help the other coagulation factor. What is through the deactivate the coagulation factor 8, for example. If this protein deficiency, then the body has a hypercoagulated state. So these people tend to have the thrombosis in the veins. So then, for example, the deep vein thrombosis, you have swelling, especially if you have this genetic disease, you have long-term immobility or long flight, 13, 14 hours. That increase the risk of the thrombosis in the deep vein. And you may not have symptoms, or may have the lower extremity swelling. The worst scenario is this thrombosis fell off, like I said, fall off, lodged in the heart or the lung. That's dangerous, cause the pulmonary embolism. So that's kind of situation. The other risk factor, of course, obesity, hyperlipidemia, diabetes. Those are increased blood viscosity, so the blood is getting sticky, thick, increased risk of thrombosis. And some medications, for example, the estrogen is a known risk factor for the thrombosis, for the hypercoagulation state. So if female, if you know it, you had a family history of a protein S deficiency, for example, or if you have previous lower extremity embolism, then you're not going to be given the estrogen, because that increases the risk for coagulation caused deep vein DVT, deep vein thrombosis, or the pulmonary embolism, PE. So these are the factors increase the hypercoagulation state. So that's why a lot of people, the other risk factor is heart disease, like for example the AFib, atrial fibrillation, because the heart is there's thrombi in the blood vessel or near the atrium or near the heart wall. If this irregular heartbeat, like shivering all the time, shaking it off, so that increase the risk of that thrombi fell off, lodged somewhere, either the brain, or that's actually majority goes to the brain, or the lower extremity. So these are that is another risk factor for the embolism. So this is a briefly talk about the risk factors and the emergency situation related to the coagulation, either hyper or hypocoagulate. So that is the major what I can think about related to this the risk factors and how to manage. When do you think you need to call your physician? When do you think you need to go to emergency room? If you particularly for the female, if you know you have the family history of protein S deficiency, then keep in mind and to prevent by increase the mobility, just walking around. If in the case of you have to sit the whole day in the office, just walk around or move your legs, contract the muscles, help the vein circulate, help the blood circulate. The same case for the long flight, and that's the other way to prevent. Also, there's the blood thinners. Those are usually prescribed to the people had the risk factors, not just protein S deficiency, particularly the AFib or previous medical history of heart attack or PE. So these you need to talk to your physician, call the physician office to discuss. So that is the video transition from B to C, bleeding problem and also coagulation problem. Thank you for tuning in. I'll see you next time.